All right, so my mate Keen said, quite last minute, would you submit a paper for this conference? And I thought, I'm really busy, I'm going to struggle to put anything together, I'm going to struggle to kind of like talk about agentic engineering, I'm too busy doing it, so I thought, I'll submit this, no chance. Fortunately or unfortunately, we're doing this one. So I'm going to talk about bipolar disorder, what living with it has required me to learn and to become aware of. And then I'm going to talk about the idea of regulators and dysregulators. So these are things that can, change or alter your state physically or mentally. These are a lot of ideas that have been in my head for a long time, which is why I chose this topic, because I thought I can probably put something together, probably not talk about it very well, but at least talk about it authentically. So here we go. Just a bit of a disclaimer. Mental health, it's a complex topic. Be kind to each other. We don't know what other people are living through or going through. Be kind to yourself. If you're not sure about yourself or friends or others, talk to a medical professional, or talk to the Samaritans. They're really good as well. So that's the disclaimer done. So when I was diagnosed with bipolar disorder, I didn't agree with the diagnosis and I didn't understand it, because I thought bipolar was kind of like this. You're a little bit up, you're a little bit down. That was my understanding of bipolar disorder. And that was not what was happening with my life or my experiences or my symptoms. They were far more complex, they were far more chaotic. There were things that had happened that I didn't understand or didn't even really remember. So what I learned is that bipolar disorder can be sometimes a bit more like this, where you can appear well and going through normal states, or these states can get very, very, very intense, both up and down, and very chaotic, and then it can all kind of normalize again. So this is what it is. It's more disordered, and these higher states can be very extreme. They can be hypermanic, which is just often high energy, not sleeping, lots of pressure, talking, this sort of thing. They can go into mania, which is prolonged periods of severe impulsive behavior, damaging behavior, complex behavior, and it can go all the way to psychosis in its most extreme forms. In the lower zones, it can be very similar to unipolar depression, and it can be similar to major depression or treatment-resistant depression, and all of these states are complex states to be in. So that's what I learned bipolar could be. I also learned it could be like this. This would be what type 1 bipolar might look like, type 2 bipolar, which is prolonged periods of severe depression, followed by a kind of uplifting state, and then potentially an extreme uplifting state, again, into manic episodes or psychotic episodes. And you can appear well for a lot of the time. Could also be like this. This could be something like type 1 bipolar disorder, where people are in a kind of fairly level state, and then long, prolonged, intense periods of severe mania or psychosis. So it's complex. And one of the challenges is that you often appear well when you're managing bipolar well, but you can also get very, very ill. So it can be that can also add to the challenge of living with the condition. So all in all, what is bipolar disorder? I don't know. I did a little bit of research. It's highly heritable. It's about 70% inherited. It destabilizes mood regulation, compromises limbic system regulation. You have hypersensitivity to dopaminergic effects, which can affect addiction. There's intercellular signaling stuff that goes on, which is why things like lithium, which is a heavy metal, can actually help treat bipolar disorder. There's all sorts of circadian biology. There's the effect that's called kindling. So kindling is the wood you use to start a fire. Kindling means that often people will have episodes which are clearly caused by a significant event, but each episode is degenerative. Each episode damages the brain's neural pathways, meaning that later events may seem to be completely unrelated to the external environment. So untreated, bipolar is a degenerative disorder. I hesitated to mention these numbers because they're horrifying, but 1 in 3 people with bipolar disorder will attempt suicide, and untreated, 1 in 5 people will complete suicide. So bipolar disorder is a severely complex and damaging and difficult condition. I hesitated to mention the numbers because they're shocking and upsetting, but also I think it was important to do justice to the reality that a lot of people are living with. So living with bipolar disorder means managing dysregulation and also what you call wellness management. So medication is the first part of this. So medication is going to try and limit these peaks and these troughs. So this is done by mood stabilizers. That will be the foundation of most treatments, which will stabilize mood, as it sounds like. It could also be sedatives. It could be antidepressants. Antidepressants can trigger mania, so it might be antidepressants combined with antipsychotics. Going on to mood stabilizers can take months because you titrate slowly to monitor side effects, and it may take multiple attempts as there are different drugs and they work very, very different with different people. So building a medication regime takes a long time. It takes a long time to establish a regime like this. And while you're doing that, you're essentially unmedicated or partly medicated. So these are difficult times. However, when you get onto a medication regime, you often then have the ability to adjust for yourself, to kind of manage your own state based on what's going around you. The next hugely important thing about bipolar disorder treatments is support. It's other people. So who are the people you trust to know about your condition and the symptoms of your condition? And who are the people you will give the agency to say, you can tell me when I appear unwell, and you can tell me from my wellness plan what I've said I should be doing. Maybe it's adjusting medication or stopping travel. And also you may give some of these people agency to say, if I don't make the changes that I've said when I'm well I will do, I'm giving you the agency to take control away from me. And you do this, and you do this in advance so that the trauma of that experience is less afterwards. It can be traumatic to have freedom taken away from you, but if you've agreed in advance that this is the consequence of not following your wellness plan, then that gives you a better pathway to recover from some of these experiences. So support is an essential part of medication. Medication on its own without support typically fails, and there's typically a lot of relapse. Support also can be therapy. It can be doing things like dealing with grief. Grief comes from loss. With bipolar disorder, you have loss of agency, you have loss of self, you have loss from the experiences that can happen. Hypomanic or manic states can lead to a lot of harm. They can damage relationships. You can spend lots of money. You can do very impulsive or risky or dangerous things. All of these things have to be processed and may involve processing grief and processing your relationships and how you feel about things. So support and psychotherapy and the people around you is essential. And one of the most effective treatments for bipolar disorder is a regime called interpersonal social relationship therapy, which is about understanding yourself and the people around you and trying to regulate. So, now we go on to regulation, which is a key part of this topic. So regulation is, we've got medication, we've got the support of the people around us, but regulation is something that you can do for yourself. This is when you try to manage the kind of red lines, which are the things that destabilize you, and counterbalance them with these green lines, which are the things that will stabilize you. It's a very active form of treatment. You have to kind of commit to doing it. You have to take action. You have to make changes. If you're someone, for example, who, I don't know, is a flight attendant, that means that you're changing time zones a lot. Changing time zones a lot is actually very dangerous for bipolar disorder because it causes sleep issues, and dysregulated sleep is one of the biggest causes of mania or hypomania. So it's effort, and your ability to engage in these activities when you're in an altered state is also compromised. If you're very depressed, it can be difficult to do things that lift. If you're very manic, you don't necessarily want to come down. You're compromised. You have a compromised sense of interoception. So perception is your understanding of what's around you. Interoception is your understanding of yourself, your internal self, your state. And compromised interoception is one of the symptoms of bipolar disorder. I don't know how we're doing for time. Could be good, could be bad. If it's bad, I'll go to the bathroom. So common regulators and dysregulators. The first one is sleep. Sleep is one of the most important, essential things to get right. Dysregulated sleep is the biggest trigger for hypermania. Hypermania will cause more dysregulated sleep, which will be a trigger for mania. By the time you're manic, you're not sleeping, potentially not for days, sometimes people for weeks, and that can be the path towards even more severe states like psychosis, followed by a big crash. So sleep, hugely important. And managing sleep might mean changing your job. So I used to live in Singapore. I used to travel to Australia at the beginning of the week, sometimes to India at the end of the week. That's a lot of time zone shifting, incredibly bad for managing sleep. And I had to change the nature of the work that I was doing to account for that. The next one is rhythm. So we're incredibly embodied creatures, and our psychological state is intimately tied to our physical state. So when you eat, when you sleep, when you talk to other people, when you do exciting things, when you do calming things, all of these things are about rhythm. When you exercise and so on. A predictable cycle of rhythm is, for everyone, a way to stay very, very healthy, and disruption to rhythm is a very easy way to become dysregulated. Again, interpersonal social relationship therapy is, and social rhythm therapy, is all about managing rhythm and all about managing processing things with other people. Stress, unsurprisingly, is a big dysregulator. Stress can require interventions and changing things. Stress comes from chaos, from conflict, but it can also come from excitement. It can come from achieving goals. It can come from big changes. And stress is hard to manage, especially in this world now, which will be the next part of the talk, the world of AI, the world of stressful AI. I keep pressing the button for the next pieces. Sorry about that. Substances. Okay, so substance use disorder in bipolar is very, 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 very high, one of the highest for any psychological condition, psychiatric condition. That might be because people self-medicate with substances to, control mood, but that will often have a backlash. But also the pharmacology that you're dealing with, the medication you're taking, these are also substances as well. So they can be regulators, they can be dysregulators. But most people, or many people with bipolar disorder, will suffer from substance use disorder, and management of that can be very, very important. Next, you have awareness. So the more aware you are of your state, the more aware you are of how you're feeling, and also the symptoms and so on, is a way to manage your condition. It's also awareness of the fact that things can get very, very bad, but hopefully they will also get better. And more episodes you have, the more you realize that you can recover from them, and that they don't necessarily mean it's the end. People are regulators, sometimes people who you know about, who you care about, who you can be your authentic self with. But people can also be dysregulators. People can be chaotic. Family can be chaotic. Friends can be helpful. Friends can not be helpful. So people is an important part of this. But again, they can be a source of conflict and instability. Therapy and integration. So this is the other part we spoke about briefly before. So how you therapize, how you talk through experiences, and then integration is how do you process the things that have happened. We all need to integrate complex experiences, grief, conflict, excitement, achievement, whatever. These experiences need to be integrated for us to be able to kind of continue. Otherwise, you build a backlog of stuff that you haven't processed and become very scattered, very disjointed, and very unfocused. There are some other surprising things as well that are regulators or dysregulators. Goal attainment is known to be quite dysregulating. It's an exciting event, but it can also lead to unknowns afterwards. It's a big change. Change is complex to deal with, so goal achievement can be challenging. Changes to your foundational beliefs can also be dysregulating, and AI is doing a lot of that, and that will be a bit of a theme of what we talk about a little bit afterwards. Antidepressants, you would have thought, are good for managing depression, but they're bad for mania. So, these things are not necessarily simple. Sunny days can be dysregulating because it can affect circadian rhythm. We don't get a lot of sunny days in the UK, so maybe that's the right place to be. But the longer days, the shorter days, all of these things can affect sleep, and it can't be overestimated how much sleep is important. Intense exercise. The other one is pregnancy. So typically when people are pregnant, they won't be able to take mood-altering medication, and that's really, really hard. That's a tremendous challenge for people going through pregnancy. Postpartum can be complex as well. Again, we are embodied creatures. The hormones that go through us, whether it's through excitement or pregnancy or whatever, can change our states enormously. So all of these different things are happening, and the risks when you get into different states can be extremely severe. So what ends up happening as you kind of go through this and start to understand it and learn about it is what I've called pathologizing happiness. So when you're starting to get more happy, more excited, having more fun, getting more engaged with things, really, really getting into things, you start to pathologize that. Am I going into hypermania? Am I going into mania? Am I overexcited by this? Am I overstimulated by this? Am I losing myself in this too much? Is this a safe place to be? Do I need to downshift? Do I want to downshift because this feels like a great place to be? Hypermania is an incredibly exciting and, it's awful to say, but wonderful state to be in. You're happy, you make friends, you care about the people around you. All new experiences are exciting rather than frightening. You're creative, you're doing more exercise, you're seeing more people. So you don't want to avoid being in states that make you happy, but you also know that these states can lead to worse states. So you pathologize constantly. You're always monitoring what's around you, you're always monitoring how you're feeling. And if you've ever got into that state of monitoring, am I feeling happy? Am I feeling happy? Am I feeling too happy? That itself is quite anxiety-inducing and a bit shit. So you often end up feeling quite depressed from that, because this constant attention and this constant checking into state is a sort of manic thing, and it's not a particularly a happy state to be in. So you ask yourself, am I shutting myself out from the outside world? Am I not having the social contact that I used to have? Are my beliefs changing enormously? And that's when I'm going to transition now into AI, because talking to lots of people in the world of AI, agentic engineering or whatever, there's a lot of this change in state, excitement, but also lack of focus, and so on. So that's going to be kind of the theme of what we talk about next, what the dysregulators are that I'm hyper aware of and that I see in the world of AI and sort of reflect on for how it feels for myself. But I also see these states in other people. I see other people in states that feel grandiose or hypermanic or overexcited or disconnected. I see a lot of behavior around me which is exciting. I also see behavior which is maladaptive. And if it was me performing that behavior, I would actually be concerned and be thinking about what do I need to do to downshift and control this and intervene on this one. So there we go. Been pathologizing everything. The world of AI, people are changing. The way people are acting is changing. The way people are focusing, the way people are collaborating is changing. So what are some of the dysregulators or the things that can dysregulate? So the first one, I worked with a therapist called Margot Oram, and she has severe type 1 bipolar disorder. And one of the things she told me that was quite surprising is that foundational changes in your core beliefs can be profoundly dysregulating. So she went on a kind of 4-day meditation retreat. It was a very intense experience for her. It was followed immediately by a severe psychotic episode. 5 minutes left. AI itself, the way it's changing us, is dysregulating. It's changing our beliefs. So how do you deal with this? I'm going to go a bit faster now and maybe skip through a few of the less interesting ones. You have to integrate experiences. How do you feel about this? Is it making you happier? Is it making you less happy? Is it changing your behavior? Addiction, I won't go into this too much then. The short cycle dopamine loop, a lot of people have spoken about with AI. It is very, very addictive to have this fast reward mechanism. There's lots of material out there about how to deal with addiction. People with bipolar disorder are much more likely to suffer from addiction. Grandiosity. I'm going to spend less time on that one because I think I have a better section that talks about this. This one I'll talk about in my anarchic way. Aggression and competitiveness, a symptom of these highly elevated states. The world of AI is pretty aggressive. So I read an article by someone saying, like, I've axed a bunch of people in my organization. I've only got space for the 100x developers. Everyone else is not as important now. That's pretty aggressive. These 100x developers, are they the best developers? Or are they just the most noisy ones who are saying that no one else is collaborating? This capitalist environment we're in actually fosters aggression and competition. So how do you deal with that? Have empathy with other people. Don't fight them. How are they feeling? Are they enjoying this world? And also have fun. Not everything has to be competitive. We're supposed to enjoy our lives. Attentional Leng Che. So Leng Che, a great grindcore band. It means death by 1,000 cuts. I'm going to briefly talk about this because you probably all know about it. Your attention just gets destroyed. Short cycle work that you're doing, being able to work on everything, kills your attention. We're constantly multitasking. I think most of us are feeling things like this. So how do you deal with it? Focus, creating space for the work that you're doing, running tasks to completion, recognizing when you're engaging in displacement activities, prioritizing, creating protected time. Pressured speaking, we'll skip past this one, except for the fact that your AI speaks to you like someone who's on cocaine. It's like non-stop, doesn't listen, no space for interruptions. That's pressured speaking. It's awful to listen to. What's even more awful is when a bunch of your colleagues take all the pressured speaking from their AI and throw it at you, and then you're like, God, it's coming from all directions. So what do we do about that? Compress, signal to noise. Like, what's the high-level message? What should this mean? Not what's the 30 pages of stuff that is your stream of consciousness that I don't necessarily want to see. So this is the key one that I'm interested in, maladaptive creativity. So this is going to get a bit philosophical. Mental model on the left is me building a system, my model of it. Mental model on the right, in the middle, is the system itself, similar but different. Next mental model is the model my colleague has. They're slightly different, but they're sort of roughly in sync because we talk a lot, we make small changes, we have to look at what we've written. Now, when AI does a lot of this for you, and it does it very fast, the mental models start to look like this. One person can create this palace of stuff. They don't really necessarily know what's in it. What they've created is very different to their mental model. The mental model from the person who is trying to understand it is even more different. When people say to me, you don't need to review pull requests, you don't need to review specs, that's wrong. You do, because it's not about quality control, it's about engaging with the mental model so I can see what someone has built and how it works, because part of my job and your jobs is also to understand that system so that we can fix it and maintain it. This is the hardest thing to manage, but it's the thing that I think will help people the most. So you share, you collaborate, you build your models together. So here we go, bipolar disorder, dysregulation, and AI. Challenges, but also things that you can do about it. I'll finish now with some awful things. I brainstormed some of this with AI. I write everything myself by hand, but it came up, it was riffing on some ideas. Tokens are cocaine. Okay, not very sensitive. How I learned to stop shipping and love the spec. Kind of all right. Hypermania-driven development, very tasteless, really tasteless. Engineering with a brain on fire. The magic and madness of agentic engineering, thoughtless. And then this one, 3 agents, 4 work trees, 2 laptops, no sleep, code shipped, marriage didn't. All caps. When I said this was all shit, it said lesson noted, drop drug metaphors, drop wonder framing on psychological topics, treat them with care. So that's it. Thank you. Thanks for your attention.
Thank you so much for a very honest, very exposing talk that was hugely interesting. Somebody is neurodivergent myself as well. Some of that I went, yeah, I can see that happening too. Yes, there is a lot of stress out there from what the models are causing for us mentally too. So, does anybody here have any questions? Can we get a microphone over here, please?
Or I can repeat the question if that makes it easier.
Might be easier.
You talked about sort of transforming core beliefs being quite dysregulated. And I'm wondering about whether... I'll start again. You talked about transforming your core beliefs being quite dysregulating. I'm wondering whether that includes things like sort of moments of revelation, sort of if you're working in science or something creative, when you're, a bit flips in your head and you see the world differently. I mean, to me, those moments they're almost what I live for. I think they're just, they feel brilliant. But is that the kind of thing that you're talking about?
Well, it's exactly that. It can feel brilliant. It can feel like everything has changed. There's so much scope to do different things. It leads to that real excitement that can kind of take you down these paths. It's not to say that they're bad. Once you've had these beliefs changed, you might learn a lot more and know a lot more. It's just that that's likely going to be counterbalanced with how do you integrate that? How has the world changed for me? Am I at peace with that? What's my role in this new world? So none of these things are necessarily intrinsically bad, but they may require that kind of counterbalance of space afterwards.
Thank you.
Another question over here? Oh, and one over there.
Shall I go? You talked about collaboration, and working with LLMs and agents is inherently very solo activity. Have you found any good ways to build in collaboration into agentic workflows?
Yeah, so at the divergent stage where you're thinking about lots of ideas, maybe that's something that's solo. When you've got your ideas and you're starting to think about turning it into a specification or a plan, that's when you move into a convergent phase with another person. I've had these ideas, how can we narrow the aperture, sorry, I work at McKinsey. So how can we narrow that down to something that we can understand? And also, can we do a handoff? You came up with the idea, you've built the specification with me, I'll move to the implementation. Will you then take the implementation and tell me if it's okay and if it's ready to be integrated? The fact that AI can offload toil should actually mean that we get more space to collaborate. So all of my stand-ups are 1 hour, because we don't need to go through the small bitty things. We can use it as kind of pair programming or pair specifying sessions, or to talk over these things. So I think there are some techniques, but I think it's the biggest challenge that I see in terms of the tech world we're in, the breakdown of collaboration.
Yeah, thank you.
What's next?
Have you found, or would you be able to share any specific prompts or maybe agents or things that would help you or us regulate our mood and, sort of control our feelings?
I'm using AI mostly to build software, but for me, what's important to regulate is more how I do that. I do it in the mornings. That's my creative time. I'll rarely have my laptop open from about 5 o'clock onwards, and I won't be doing creative work then. At that point, I need to be kind of transitioning down into a state where I'm less stimulated. So some of this is about saying to AI, don't give me lots of information, give me small pieces, and I will direct where we go next. Other parts of it are simply about when you decide to switch off and say, I'm not going to listen anymore. I need time to kind of go away, calm myself down, and then I'll come back to it tomorrow. So creating space, but also creating friction, which is also how people manage addiction, is to create friction in systems.
Okay, I think you're going to have to... I know there's another question. Please do feel free to come back and ask the question afterwards.
Yep, that's fine.
But I am going to have to reset for the next session. So thank you very much for joining us today. Dave, thank you so much for your talk.
Thanks. Cheers, Katie.